Hello, folks. My name is Jason Oko. I am the Data and Preparedness Coordinator here at Maine EMS. Wanted to take a quick minute to run through with you some of the changes that we've made to MEFIRS to address the EMT skills expansion and how to document the use of those new skills once you've performed them. So the first thing that we'll talk about that we've added is a 12-lead power tool. Now, 12 leads have been added to the scope of practice for EMTs, but this power tool can be used by any level. When you open it up, depending on your agency settings, it will default to the crew member who's logged in. I'll go ahead and add myself. We'll see that it adds me as a paramedic because that is my license level, but you could select any of the appropriate license levels here. Then it asks you just a couple of questions that you have to select about: was the procedure performed prior to your unit's care? Typically the answer here will be no. A lot of these fields are defaulted and already selected for you. And then we come down to this section, which is the 12-lead rhythm identification. We'll say no, it automatically filled me in. And then we have that it's a 12-lead for the event type, and the ECG lead is a 12-lead as well. And then we have here the type of rhythm that we are identifying. And the one thing that we should note here is that EMTs do not have to complete this section. They don't have to identify the rhythm, or they can select this EMT acquired rhythm not interpreted for their rhythm. And they do not have to document any ectopy as well. And then just click the OK button, and that will be all that an EMT will be required to document for a 12-lead right now. The next thing that we'll talk about is CPAP application. So there's a new power tool for CPAP that you can document, and it is defaulted to CPAP. The same premise: you select your license, select who it is, select your license level, response to the procedure. Everything else is defaulted. You have to select the dosage of the oxygen, so the volume of the oxygen that you've applied with your CPAP, because that is a medication that you're administering, the response to the medication, and then click OK. And you've completely documented the application of the CPAP and the documentation of the administration of the oxygen that goes along with the CPAP. And finally, we will talk about the nebulizers. The nebulizer tab is available here. Same premise, it's available as a power tool. You can fill in who you are in administering it. Was it before your care? No. Then going through duoneb or albuterol for EMTs. In advanced EMTs, it's only going to be duoneb. And then all the other fields are pretty much defaulted: the patient's response, any complications, and the oxygen administration component as well, just the dosage. The dosage units is defaulted as well as the route, and everything is all set. And then just click OK, and then you will see that these have been added in your procedures and your medications as well for you. Next thing I'd like to point out is this power tool for masking your patients. Highly advised that you click the time button, then select the pre-canned patient arrival button, and that everyone masks their patients as soon as they arrive with their patients, unless they're unable to for some strange reason. And everything else here is defaulted, and then just click OK, and it'll add that procedure of masking your patient right here in the procedures. You can add any one of these procedures or medications or EKGs right here in the treatment tab under procedures, medications, or EKG. Same, you would do it for any other type of procedure, medication, or EKG as well. Thank you, and that concludes my video here.